Unexplained vulval or vaginal pain is one of the most under-investigated symptoms in women's health. Unexplained is not the same as imaginary. It doesn't mean in your head. And today, let's see if we can find yours. Hey, I'm Dr. Sylvia, a UK GP and women's health doctor. We are talking about two key areas. The vulva is the outer part of a woman's genitals, and the vagina, the inner canal, where your period flows from, or the channel through which babies are born naturally. Here are 6 reasons your vagina or vulva may be hurting. Vulvodynia is a term medics use to describe this condition, and it means chronic vulval pain that won't go away. To qualify for this diagnosis, you would have been going through it for at least 3 months with no obvious physical problem when we examine your vulva and vagina. Now, how it feels can really vary a lot from one woman to another, because some women talk about a constant burning sensation, like sitting on a hot surface. Others talk about stinging or a raw sensation, or a feeling as if your skin has been scraped. The pain can be localized just to one part of the vulva or spread right across the entire area. We think it develops from a combination of sensitive nerves, changes in the way your body processes pain, and many times because there is coexisting problem with your pelvic floor. In terms of treatment, it is what we call a multidisciplinary problem, and that means more than one specialist or more than one type of treatment will be recommended to manage the problem. So we may provide you with anesthetic cream or gel, pelvic floor physiotherapy, specific nerve pain medications like amitriptyline, gabapentin, as well as psychological support for the impact this condition can have on a woman's life. Keep track of your symptoms and ask for a referral to a vulval clinic or a gynecologist. Vaginismus is when the muscles at the entrance of the vagina tighten without your control or involuntarily. That situation makes penetration to the canal painful, difficult, or sometimes completely impossible. And many women with this condition describe a burning or tearing sensation during any attempt at penetration, whether that is having sex or having tests like a cervical smear, or even using tampons. Sometimes they might describe the sensation of hitting a wall. Now, vaginismus can be primary. This is what we say when it is present right from the very first attempt to penetrate the vaginal canal, or it could be secondary, in which case it has developed after a period when everything seemed fine. And this could be after having a baby, having a painful procedure, gynecological procedure, or a distressing sexual encounter. It's a physical muscular reflex. It can be connected to anxiety, but not all the time. It is not a character failing. There are different treatment options we have available, including physiotherapy to heal and support the pelvic floor, retraining the vaginal muscles using vaginal dilators under professional guidance, and psychosexual counseling. So this condition is very treatable. One important note I'll add is please don't push through the pain. The specialists say that actually makes vaginismus worse, not better. Vestibulodynia is a more specific form of vulvodynia, the first reason we talked about. It is pain that's localized to the vestibule, that is the entrance of the vagina. And women who've experienced it describe a sharp, burning or stinging pain sensation, specifically at penetration. The skin around the vestibule might also appear red and irritated and tender, sore when the doctor tries to examine. Now, in terms of what causes vestibulodynia, we think it might happen because of conditions like having thrush over and over again because it sensitizes the tissue, or it may develop from low dose or low strength estrogen birth control pills. It might even happen following a drop in the hormone levels after you've had your baby. If you're watching this video and are experiencing these type of symptoms and have recently or been on a low-dose estrogen birth control pill for a while, it's worthwhile having a chat with your doctor to see if the two may be connected. This is one of the more under-recognized associations in women's health. If this is the first time someone has named a symptom or symptoms that you've been living with, that is exactly why this channel exists. Lichen sclerosus. So let's move away from the V reasons and discuss a chronic autoimmune skin condition. Lichen sclerosus causes the skin of your vulva to become thin and fragile. And crucially, you may see white or pale patches around the area. Women with LS describe itching, burning pain, particularly during sex, when the fragile skin of the vulva can tear. The skin may look pale, shiny, or crinkly when we examine it. Now, if it's not treated promptly, lichen sclerosus can cause changes to the appearance and the structure of the vulva. For example, the little lips or the labia minora can stick or join or fuse together. The vaginal opening can get narrow, which makes the pain during sex continue to get worse, not just happening once in a while. And here's one of the most important reasons not to leave this particular vulval or vaginal pain without addressing it or treating it. There is a small cancer connection. We know that untreated lichen sclerosus carries a small risk of vulval cancer. However, getting the right treatment protects you. If you want the full deep dive into this, I have another video dedicated to lichen sclerosus coming up in this series. The pelvic floor is a hammock of muscles at the base of the pelvis, holding up your organs, the bladder, the womb, the rectum and anus. And when those muscles are too tight or weak or poorly coordinated, they can cause pain. Women with these troubles experience deep internal aching pain with deep penetration during sex, a feeling of pressure or heaviness in the pelvic area, and even difficulty with their bowel movements. Now, there are many different reasons, but some of them can include after a complicated childbirth experience, if you suffer from chronic constipation, always straining at your stools, if you go into bad posture habits as a result of a high-stress job or activity, if there was trauma or some injury to your pelvic area, all of that can lead to pelvic floor dysfunction. Of course, the good news is that there is treatment, and this one is not negotiable, and it is pelvic floor physiotherapy. Yes, working with a specialist trained in women's health internal assessment. It's really important to note Kegel exercises are great. I'm all for them. I've even got a video on Kegel exercises on the channel, but they're not always the answer. If your pelvic floor is already too tight, and in many of these cases it is, strengthening it further with Kegel exercises is just going to make things worse. So the first thing to do is to get a proper assessment before embarking on any form of therapy or getting or buying any device that promises to solve the problem. As estrogen levels fall in perimenopause, postmenopause, after having your baby, even while breastfeeding, the lining of the vagina gets thinner and our natural lubrication reduces. We refer to issues like this, especially around menopause, as the genitourinary syndrome of menopause or GSM. And many women describe the dryness, the burning sensation, feeling raw in that area every day, and pain during sex that just gets worse over time without treatment. The vaginal walls may look thin and pale when we examine them. The treatment, again, good news, we do have options. First, vaginal moisturizers. Many of these are non-hormonal, applied twice or 3 times a week. That's often the first step. Your GP can also discuss other options. Some of them are hormones that can be applied locally within the vagina alone. The most important thing I will say is that this is one of the most treatable causes of vaginal pain. But some women lose out because they're too embarrassed to talk about it. Please don't be that woman. I have a video on the different treatment options here. If you're a nurse, doctor, or other medic watching this video, I'd love to know, what patterns are you seeing in your local clinic? Please drop a comment below. 6 reasons. And did you notice something? Not one of them will show you anything clearly on a swab test. Not one of them will be obvious in a busy 10-minute appointment without the right questions being asked. And that's why women can go years without their answers. Not because the answer doesn't exist, but because until this video, we didn't ask and answer the right questions. You came here because you've been experiencing pain in the vagina, and until 8 minutes ago, you didn't have a satisfying answer. I hope today starts to change that. 6 possible reasons, most of them completely treatable when we get the right diagnosis. So don't accept everything looks normal as the final answer. Ask for a vulval clinic referral. There, they've got a bit more time to examine. They've got the right equipment to look properly. Or ask for a pelvic floor physiotherapy assessment. Ask for a hormonal review. Heck, bring this video along to your GP appointment if you have to. Let's not accept your pain being dismissed. So tell me, how long have you been waiting for an answer? Drop it in the comments. 1 word or 100. I do read them all. And if this video helped you feel less alone today, please share it. Somebody in your life or in your network may be sitting in exactly the same pain, too embarrassed to look into it. Send it to her. And guess what? We are nearly at 100,000 subscribers on this channel. That milestone matters so much to me. And you being here is part of it. Subscribe to help us get there. I'll see you in the next video.